Ottawa scaling back its temporary foreign worker program has doctors warning about the consequences to our healthcare system. Last year, the Trudeau government set a 2026 target of accepting 82,000 temporary foreign workers. The new federal budget is reducing that target to 60,000 approvals. The cuts come as new data shows how Canada's healthcare system is increasingly reliant on this program. For more on what the changes could mean for healthcare, we're joined by Dr. Bernard Ho. He's an emergency physician at Mount Sinai Hospital in Toronto. Good morning.
Good morning, Anne-Marie. Thank you for having me.
I just want to set up our conversation by sharing with everybody the latest numbers from Statistics Canada of just how many TFWs are keeping healthcare moving in this country. So in 2000, Canada's healthcare system employed 3,200 temporary foreign workers. In 2022, that number spiked to 57,000. What role are these workers playing in healthcare system, and what will happen when they're no longer there?
Yeah, they play a pretty outsized role in our healthcare system, and I'm concerned that with these cuts, we're going to see exacerbation of some of these staff shortages that we're seeing across the country. You know, with fewer temporary foreign workers coming into the under the program, the healthcare employers will have a smaller pool of staff available. And given that our sector relies pretty heavily on internationally recruited staff, and many of these workers stay on permanently, the cut significantly affects health and human resource planning. And so healthcare facilities will need to rely more on costly agency staff, pay more overtime, or reduce services like less home care visits or less access to long-term care beds. You know, these pressures will quickly trickle down to patients in terms of wait times, continuity of care, and ultimately patient outcomes will be affected.
Dr. Ho, I think I would offer that I think patients are already feeling the shortages that are happening in healthcare centers and clinics and in hospitals. Can you give us a sense of what role the TFWs play in the healthcare system? Is it doctors, nurses, PSWs? Where are we finding the bulk?
For sure, yeah. So according to the data from StatsCan, the temporary foreign workers make up part of the total hospital workforce, ambulance workers, and nursing residential care services and in home care services. And the majority of them work in nursing, residential care, and home care services. And so I see this all the time in my ER, where patients need more access to home care services, to PSWs, or to nursing support in these in nursing homes or long-term care homes, but they're not getting them because of the staffing shortages we're seeing across the country. And so again, with these cuts to the temporary foreign worker program, we're going to see exacerbations of these shortages.
We've had so many conversations on this show about Canada's healthcare worker shortage, and part of the goal in reducing temporary foreign workers is to fill those positions with citizens. So what needs to change in the system in order to attract citizens to those jobs?
Yeah, so we definitely need to improve our health and human resource planning, and we need to start training Canadians now to fill those gaps. But I think part of this rhetoric misses the nuance. These workers fill real gaps in a very overstretched system, and there isn't really a pool of trained Canadians ready to fill these gaps at a moment's notice. And so the real issue isn't overdependence on these foreign workers. It's more so under planning. And so if we want to rely less on temporary programs, we need parallel investments in training and retention and in fair immigration pathways. But, you know, all of these measures take time. And so cutting the supply pipeline without simultaneously filling the gaps doesn't make a lot of sense to me.
Especially to a system that is already full of gaps and pressures that we feel even now. The federal budget includes new measures aimed at making it easier for those who are seeking citizenship, who have been licensed abroad, to be able to use those actual skills here in Canada. We all know the story of people who've been trained abroad who are doing service jobs or non-medical jobs because they just can't practice their skills here. The new Foreign Credential Program Action Fund is receiving $97 million in 5 years, or over 5 years, to improve the fairness, transparency, timeliness, and consistency of the foreign credential recognition. So how far does this money go in addressing the shortages you and I are talking about?
I think it would definitely be a good step. I think we obviously rely on temporary foreign workers, and we should definitely be protecting them and providing them as many resources as possible. So the solution is to provide more funding, and the solution is also to give them the same protections and pathway to permanent status as other Canadians who are working in the sector, as well as stronger oversight over their employers.
Dr. Ho, I was holding my head in your last answer because I think anybody who has been either in our healthcare system right now or is working in our healthcare system in hospitals like yours knows that the shortages are already there, the lack of service, not because of will, but because of positions and shortages, is being felt. So as a frontline health worker, what signs are you going to be watching for as the temporary foreign worker program is scaled back by thousands.
Yeah, so I'll definitely be looking at the wait times in the ER, which I see quite often, ballooning wait times and more people in the waiting room. I'm going to be looking for the elderly patients that I see in the ER and whether or not they're actually able to get into the long-term care beds, into nursing homes, and the outcomes that I see from them in terms of whether or not they're are they falling more? Are there more infections that are happening because of these shortages, which I'm seeing more and more, but hopefully when we fill these gaps, we'll see less of these outcomes.
I'm really glad you came on today to discuss this with us, Dr. Ho. You're an emergency physician at Mount Sinai Hospital in Toronto. We know you're busy, but we know this is important to you, so thanks for taking out the time.
Thank you for having me.
By the way, we reached out to Immigration, Refugees and Citizenship Canada. We did not receive a response in time for this interview.
If you like that video, make sure to subscribe to the Your Morning YouTube feed, where you can find all kinds of new content posted every weekday morning.